Hello everyone, I am Dr. Madhavi Pant, an ENT specialist currently working in NMC Medical Center, Shahba, Sharjah. I have more than 8 years of experience as an ENT surgeon. My areas of expertise are ear infections, nasal infections like rhinitis, sinusitis, tonsillitis, pharyngitis and laryngitis. Today we are going to discuss about a very important topic, that is sudden sensorineural hearing loss, which is a full-blown medical emergency. Surveys have been done and it is recorded that 4% of population in UAE suffers from impaired hearing. WHO has also recorded the same number. It's around 3% of Middle East people are suffering from disabling hearing. So, sudden sensorineural hearing loss is an acute and sudden drop in hearing threshold. Usually the patient feels sudden loss of hearing upon awakening or overnight. The golden rule here is there should be more than 30 decibel of hearing loss in 3 consecutive frequencies over a 3 days of span. Time is critical with sudden sensorineural hearing loss. Studies have revealed that the patient doesn't receive a prompt care, there is a very significant drop in hearing recovery. Patient must seek attention within 24 to 48 hours of symptoms onset. So whenever a patient notices the hearing has dropped, and the first thing is we have to rule out the conductive hearing loss. Suppose the patient has impacted wax. When we remove the ear wax, there will be an immediate recovery of the hearing. So the patient doesn't need further evaluation. After we finish the clinical examination, we do the tuning fork test, which will rule out whether it is a conductive type or sensorineural type of hearing loss. The gold standard to diagnose sudden sensorineural hearing loss is pure tone audiometry. The audiogram will show 30 decibel or more loss in the hearing threshold over 3 frequencies, which will be in 3 days of span. The mainstay of treatment for sudden sensorineural hearing loss is high-dose corticosteroids, that is to be given according to the patient's weight, 1 mg per kg per day. Suppose a patient weighs 60 kilos or more, the dose should be 60 milligrams per day. That should be given over 2 weeks of period and then it should be tapered. The corticosteroid should be given promptly and we should never wait for the audiogram reports. There are various other treatment modalities. Suppose a patient has viral infection in ear, so antiviral agents should be given. If there is bacterial infections, antibiotics should be given. If there is autoimmune disorders, then we have to give immunosuppressants. So we have to tailor our treatment according to the etiology. Unfortunately, what happens is more than 60 to 90% of patients, they don't have any cause. So we label them as idiopathic sudden sensorineural hearing loss. Some patients, they don't tolerate oral corticosteroids. Suppose the patient has uncontrolled hypertension, uncontrolled diabetes. In that situation, we prefer giving intratympanic injections of steroid. The steroid, what they does inside the ear is they reduce the inflammation and swelling of the inner ear. If there is severe to profound hearing loss even after the treatment, then rehabilitation is needed. Usually for the patient with moderate to severe hearing loss, they will go for hearing aid trial and the hearing aids will be fitted. If there is a profound hearing loss or if the patient doesn't benefit from hearing aid, then they will undergo cochlear implant. So what is cochlear implant? It is a surgically implanted device in the inner ear which will amplify the sound. In most cases, up to 60 to 90% of population, the cause is not identified. So we label it as idiopathic sudden sensorineural hearing loss. Among 10% of patients where we can identify the etiologies, which can be viral infections, bacterial infections, autoimmune disorders, circulatory disorders, brain tumors or toxic exposures. The key point here is sudden sensorineural hearing loss is usually unexplained, so we have to give oral corticosteroids promptly. Definitely, the most common risk factor for hearing loss is noise exposure. There was one study done where it showed that among steel factory workers, 89% of population were exposed to hazardous noise level. Alarmingly, 45% of them never used ear protective measures. Chronic exposure to loud noise, not only that, even the leisure, like using headphones, earphones for a longer period, it will lead to noise-induced hearing loss and tinnitus. 2/3 of the patients recover fully or partially. If there is only involvement of single ear, the chances are high, whereas if both ears are involved, the chances of recovery decreases. My take-home message for this topic is time is hearing. So whenever you feel like your hearing has dropped suddenly, do not wait. Seek medical attention at the earliest. So I believe that I have been able to give you a brief idea about what is sudden sensorineural hearing loss, how it is evaluated and how it is treated. If you want to know more or want to consult with me, I am Dr. Madhavi Pant, specialist ENT surgeon working in NMC Medical Center, Shahba, Sharjah.